Welcome to USDTL's ToxTime on how to identify and understand fetal alcohol spectrum disorders. I'm Sandra Andrews, an account development manager at USDTL. Thank you for joining us. Our presenter today is Guida Brown, the Community Relations Consultant for USDTL. She holds degrees in both journalism and management and brings extensive experience from her long-standing career in Kenosha County's nonprofit sector. For 13 years, she served as executive director of the Hope Council on Alcohol and Other Drug Abuse. Her professional background also includes roles at AM Community Credit Union and Women's and Children's Horizons. In addition to her nonprofit work, Guida has taught as an adjunct faculty member at several universities. She currently operates her own consulting business, Guided by Guida, and holds certifications in substance abuse counseling and related fields in the state of Wisconsin. Before we begin, please submit your questions in the Q&A section at any time. We'll address them during our Q&A session at the end of the presentation. A recording will be sent to all registrants, and live attendees will receive a certificate of completion via email within 24 hours. Please note that the opinions shared during the sessions are those of the presenter and do not necessarily reflect the official policies or positions of USDTL. Now let's welcome Guida Brown.
Hi, I'm Guida Brown, and I appreciate your presence at this ToxTime. Before I get started, I just want to tell you that I used this competency-based curriculum development guide for much of this PowerPoint, and you will see the link in the reference page at the end. I'm not going to read all of our learning objectives and goals to you, but I will say that fetal alcohol spectrum disorders are not rare, they're just rarely diagnosed. And so I'm going to drive home the fact that we need better diagnostics. In the United States, approximately 5% of the population is affected, and we need prevention, intervention, and treatment. So learning goals: identify FASDs across the lifespan of individuals, describe the developmental and functional concerns for those with FASDs, learn about interventional approaches. An overview of fetal alcohol spectrum disorders. Individuals who have prenatal alcohol exposure could have either an FASD or fetal alcohol syndrome. Fetal alcohol spectrum disorders is not a diagnostic term in the United States. It is elsewhere. In the United States, we use that only as an umbrella term to describe the range of effects that can result from that prenatal alcohol exposure, whereas fetal alcohol syndrome is a diagnosis usually made by a dysmorphologist, a clinical geneticist, or a developmental pediatrician. So FASDs by other names, this is that umbrella. And we have other effects under there. So we talk about fetal alcohol syndrome. Again, that's that full diagnosis. We no longer use the term fetal alcohol effects. That's an old term from the 80s or 90s where we talked about fetal alcohol effects. Right now, we use the alcohol-related neurodevelopmental disorders, the alcohol-related birth defects, or the neurobehavioral disorder associated with prenatal alcohol exposure. Most clinicians are aware of fetal alcohol syndrome, which is the most involved condition within the spectrum, but FAS does not encompass the full complement of diagnoses under the umbrella of fetal alcohol spectrum disorders. And there are specific criteria that exist for diagnosis of fetal alcohol syndrome, and more recently for the NDPAE, but research continues to provide more clinical clarity for all conditions within the spectrum. So I told you FAS is a diagnosis. NDPAE is a diagnosis. These others, we're working on it, but there is no diagnosis for ARND in the diagnostic manual. So we're working on it. We're trying. The field is moving forward, but it's not been fast. So the impact on pregnancy. Fetal alcohol spectrum disorder is the most common preventable cause of mental disability in the Western world, with an estimated incidence in North America of 9.1 per 1,000 live births. But the full-blown fetal alcohol syndrome, so um, fetal alcohol syndrome with the facial features, is comparable to Down syndrome and spina bifida, but fetal alcohol spectrum disorders could be 5 times greater. And so FAS may just be the tip of the iceberg, and the FASDs are 10 times more prevalent. We see FAS in about 10% of the population that has prenatal alcohol exposure effects. So not necessarily prenatal alcohol exposure, we don't even know all of them, but about 10% of the population who has an FASD is diagnosed with fetal alcohol syndrome. There was a JAMA study done in 2018 that estimated the prevalence of fetal alcohol spectrum disorders among first graders in 4 U.S. communities between 1.1% and 5% using a conservative approach. So again, 1 in 20 has a fetal alcohol spectrum disorder. The findings may represent more accurate U.S. prevalence estimates, but they may not be generalizable to all communities. So you might not go into every community and see a 5% FASD ratio, but it's more like 5% than that 9.1 of 1,000. What we see instead far too often is that other diagnoses are made for people who have an FASD. So the first column here is fetal alcohol spectrum disorders, and then across the top we have ADHD, autism, bipolar disorder, reactive attachment disorder, depression, and oppositional defiant disorder. And all of these disorders have overlapping characteristics, but even more importantly is that all of these disorders can look like an FASD in some respects. So far too often we are diagnosing maybe oppositional defiant disorder instead of an FASD, or ADHD where a person can get a pill instead of an FASD. And so this is the second page of that same slide. It tells you, so for example, ADHD, a lot of those X's match up, but with ADHD, they don't need to be reminded on a regular basis to, remember to do things, daily concepts. They don't need to be reminded of things. They don't have trouble remembering rules. And so oftentimes the easier diagnosis is the low-hanging fruit of one of these other things that also has the ability to give a prescription pill. And that's not resolving the problem of FASDs. The United States is drinking more. So alcohol use among women 18 to 44. Women are drinking more, period, than they ever did before. And this next slide is that they are binge drinking more. I just saw a study that says that women are now binge drinking more than males are. And so, of course, the problem with this is that women are getting pregnant and might not even know that they're pregnant. This just is more of the same. An episode of binge drinking for women of childbearing age is defined as 4 or more drinks in about a 2-hour period, drinking to drunkenness in about a 2-hour period. And anything over 1 drink a day for women is over the moderate drinking level. We have lost our filter on what is appropriate drinking. I'm from Wisconsin, and I can absolutely guarantee we've lost our filter here, but across the nation, we've lost our filter to say that a woman should not be drinking more than 1 drink in any given day. I had a friend who's a nutritionist who asked me, she doesn't drink often, but when she drinks more than 1 drink. Is that bad? And I said, well, I don't eat dessert every day, but when I do, I eat 4. Is that bad? We know that, right? I mean, I don't understand the logic, but that's a question that was asked. So, So now, to add on to already problematic um, issues with newborns, we have a fetal fentanyl syndrome that was identified in 2023. Infants had relatively low growth parameters and shared feeding difficulties, these distinctive facial features, and some of the following common physical findings: single palmar crease and adducted thumb that you can see in some of these middle pictures. Uh, Toes 2 and 3 were fused or partially fused. You can see in these bottom pictures. Genital anomalies for males, and foot position abnormalities that you can see in the bottom left picture. Um, we are also seeing fetal nicotine syndrome from cigarettes and now vaping. And there is neurobiological problems, pulmonary problems, and cardiovascular problems that neonates are having due to fetal nicotine exposure. And also identified in 2010 was fetal cannabinoid syndrome, the adverse effect of prenatal exposure to cannabis, which is the most prevalent illicit substance abused by pregnant women. And self-reports indicate about 2 to 6% of the time, whereas blood tests report about 11% of the time. We also know that cannabis is getting much stronger, and so the content of THC used to be, we know this, 3.4% ish. Now it's gotten up to 30, 90%, depending upon what you're using. It's much higher. And human marijuana consumption during pregnancy appears to have lasting effects on the child's higher cognitive function. So the best public health message has been that no amount of alcohol or other drug consumption can be considered safe during pregnancy or when trying to get pregnant. All types of alcohol are equally harmful, including all beers and wine. Uh, if a woman of childbearing age is having sex and drinks alcohol, she's advised to use effective birth control effectively. Women who are pregnant or who might be pregnant should not drink alcohol, including women who are trying to get pregnant. It's never too late to stop drinking. Brain growth takes place throughout pregnancy, so the sooner the drinking is stopped, the better the outcomes for mother and baby. And drinking alcohol during pregnancy can cause lifelong physical, behavioral, and intellectual disabilities. FASDs last a lifetime. There's no cure for FASDs, but early intervention can improve a child's development. So oftentimes women get pregnant without even knowing that they are pregnant. And so it's important to, if someone is trying to get pregnant, not drink. It's also important to use effective birth control effectively. But what does that even mean? We know that birth control pills, when used with antibiotics, become less effective. We know that birth control pills not taken at the exact same time every day become less effective. So we have to do a better job of teaching about alcohol use during pregnancy or during times of getting pregnant. Accutane is a adult acne drug that you have to prove 2 forms of birth control in order to be prescribed. Every month, 2 forms of birth control. But a pregnant woman can go into a grocery store and buy a cart full of alcohol, and no one has the right to say anything, or the ability to, or no legal ramifications. So there was a "What would you do?" with John Quinones, "What would you do?" And it was a pregnant woman who was at the bar and drinking shots. And some of the people in the bar were actually buying her shots, literally saying, "I know how hard it is to be pregnant. Let's have a shot together." And so we have to recognize that societally, we're not doing a great job when it comes to our best public health message. What's a drink? That's another thing societally we are not understanding. So you would do an exercise. Kids always know what a drink is, but adults somehow forget it. So a drink is any one of these properly poured drinks. So I would take a shot glass, a beer bottle, and in a wine glass, and I would properly pour the liquid to the limit that it should be. So a shot glass is that 1.5 ounces. That wine glass, note particularly the third picture here, it's not to the rim, right? That's not what wine is supposed to be poured to. The bowls are big so the wine can breathe, but oftentimes we pour wine all the way up. A can of beer or a bottle of beer, if it's a regular Miller Michelob, it's going to have the same alcohol content, but IPAs don't. So we have to be aware of what really is a drink. So I would take my standard drink, my shot glass, my beer bottle, and my wine glass, and I would pour the liquid in, and then I would take 1 drop of alcohol or 1 drop of food coloring and put that in. That's the alcohol, right? That's the amount of alcohol, which is about 0.6 ounces of pure alcohol. It doesn't matter what the base is, it matters what the alcohol is. And so in a properly poured drink across the table, all the alcohol content is the same. Now, again, if you eat a supersized Hershey bar, is that 1 serving? It is not. If you read the back of a can and it's an IPA and it says it's 1.5 servings, it's 1.5 servings. So it has to do with the amount of alcohol in it. And maybe maybe it still says it's only 1 serving, but it's not one of these standard drinks. So we have to consider what's non-standard as well as what is standard, as well as what we drink versus what we are expected to drink. Just like I have to consider not eating a whole candy bar. Clinical recommendations. We need to educate women of childbearing age about alcohol, contraception, and FASDs. We need to ensure alcohol screening is done for all women of childbearing age. We need to ensure that SBIRT, the screening, brief intervention, referral to treatment, is done for women of risk. We need to refer patients and clients for alcohol treatment as indicated, particularly those with a child with an FASD and those with a history of alcohol misuse or addiction. We can use umbilical cord tissue testing to include alcohol, because right now oftentimes it doesn't, as though alcohol is not a drug, and I am here to tell you it is. It's one of the most dangerous. We need to ensure that screening and appropriate diagnosis is done for individuals with possible FASDs, and then we need to manage and coordinate that treatment for them and refer patients and clients to appropriate services. This is a great decision tree used in Colorado for toxicology testing guidelines algorithm. And again, it's great. It's really good if we're asking the right questions of the right people, but we could do better. Well, what if we universally tested the umbilical cord tissue of every baby? So hear me out. We'll talk about this throughout the rest of the slide, off and on. Um, Cannabis is the most prevalent illicit drug used by pregnant women. Prenatal THC exposure is significantly higher in states that allow medical or recreational cannabis use. 1 in 7 pregnant women are using alcohol, and about 5% of them are drinking. Fentanyl is proving to be toxic to neonates. We know that we're not capturing all of the babies who are born with prenatal substance exposure. A study in Utah from November 2020 to November 21st, 2021 resulted in 1,700 samples, umbilical cord testing across 37 hospitals from Utah, 82% of the hospitals, 91% of the births, and statewide 9.9% were positive for at least one substance. 9.9%, 10%. 1 in 10 babies has a positive test for a substance. So what would this look like if we tested umbilical cord tissue from every single baby born? We'd get about a 10% return on that testing. And we shouldn't be penalizing people for having a disease. So I know that this becomes a conversation about discrimination and race, but if we did it across the board, we would be capturing a lot more affected neonates and being able to treat the disorder for both the parents and the babies. Oftentimes we defer to CAPTA, the Child Abuse Prevention and Treatment Act, and it doesn't use language about a positive test. CAPTA doesn't say anything about a positive test. Instead, it does talk about neonates that are affected or have withdrawal symptoms, and it talks about FASDs, but it doesn't define what has to happen. That decision is left to the state and to the hospital system. So my contention is we do a better job of recognizing and treating, and don't focus on the negative aspect. Far too often, tests have become gotchas, and that should never have been the intention. My sister has diabetes, and when her sugars are out of whack, no one's throwing her in jail. My husband had heart surgery. When his INR was out of whack because of the warfarin, the doctor never called him and said, hey, we're going to need you to report to the jail. We're going to need to do some flash incarceration for you. So why are we doing that with mothers who may or may not have a substance use disorder? Why are we not treating the substance use disorder just like we treat the behavioral problem of diabetes, or we treat the possible behavioral problem of cardiovascular disease? We're doing a terrible job of treating the disorders, and instead we're ignoring it under the guise of, well, we don't want to be punitive. We don't. That's a fallacy. That's an either or fallacy. We don't have to ignore it. We can identify it and then treat it, and everyone has a better chance. So the potential effects of prenatal alcohol exposure: premature birth, pre and postnatal growth retardation, physical malformations, microencephaly, which is that small head circumference, and cognitive and behavioral problems. The smaller the brain, the smaller the head. This is a baby's brain. Baby on the right had an extreme case of fetal alcohol spectrum disorder. Baby on the left did not. These are post-mortem pictures. So that microencephaly, that smaller head circumference, is because the smaller the brain, the smaller the head. Alcohol in the developing fetus. It readily crosses the placenta, affects the organs can't metabolize alcohol. Fetuses are not little adults. They can't, their bodies don't react the same way. So they're exposed to alcohol concentrations about the same level as the mother, but little tiny babies, right? They are affected by timing, dose, and other fetal maternal factors. And there is some catch up that is possible if the drinking stops at any time during pregnancy. So that's always important to say, just because somebody might not have known she was pregnant and then found out she was pregnant and had a binge, they shouldn't keep drinking. That there's no reason to continue drinking. Using alcohol during pregnancy is like throwing chaos into what needs to be a highly regulated system. We know that we shouldn't eat cold cuts during pregnancy. We know that we shouldn't eat sushi during pregnancy. We have to do a better job of letting people know that they shouldn't drink alcohol during pregnancy and other maternal factors. So if person A drinks a little bit during pregnancy and person B drinks a little bit during pregnancy, but person A has stress or nutrition problems or poverty or a previous child with an FASD or multiple pregnancies before, person A is going to be more likely to have a baby with an FASD. So again, it's across the board. It's not just happening to those people. It isn't even just happening to somebody who only has alcoholism. This can happen to anyone because of other impacts. I'm a huge fan of Lilo and Stitch, and the new movie talked about alcohol as a celebratory poison. I actually think the old movie did too, but the new movie talked about alcohol as celebratory poison. And I think if all of us talked about alcohol as celebratory poison, we would drink a lot less alcohol. Again, there is no known safe level of alcohol use during pregnancy. And the higher the BAC level, the longer the exposure, the greater the risk alcohol poses to the developing embryo and fetus. Alcohol is a toxin, alcohol is a toxin, alcohol is a toxin. It's poison. The timing of the exposure. First trimester has those major physical abnormalities, the sentient facial features, and then the growth retardation neurological effects. Second trimester, more opportunity, more risk for spontaneous abortion, growth retardation, neurological effects. Third trimester, growth retardation and neurological effects. So that first trimester is really important, but the second and third trimester also have impact, right? So again, stopping affects change, positive change at any time. Other factors, maternal age after 30. If a woman drinks during pregnancy, she is 2 to 3 times more likely to have a child with an FASD. That gravidity I talked about, the higher the number of prior pregnancies, the greater the chance of having a baby with an FASD. And stress. Animal studies indicate that alcohol consumption combined with maternal stress statistically increases rates of miscarriage and stillbirth, as well as lower infant behavioral scores. So the baby in weeks, this is not specific to a diagnosis, but it's important to see that that first trimester is again where those sentient facial features could come up. The heart, the arms, the legs, the eyes, the ears, even the teeth and the palate. But notice that that central nervous system goes across the entire pregnancy. So again, alcohol use during pregnancy can lead to lifelong effects. It's about 1 in 20 US school children has an FASD. And I always wonder what happens to them after they stop being school children because they're walking around among us. I will tell you that the majority of people, maybe not the majority, huge number, about 30%, I think it is, I could be wrong, huge number of people in our systems of incarceration have undiagnosed FASDs. The cost of drinking while pregnant in 2010 was $5.5 billion. This cost is not going down. There are physical issues that lead to behavioral and intellectual disabilities that lead to lifelong issues. The impact of FASDs, again, delayed development, hyperactivity, learning disabilities, behavioral problems, the underdiagnosing and the treating of other disorders is problematic when we're looking at learning disabilities, behavioral problems, hyperactivity. It's easier to pick one thing and say, oh, this is what's wrong, instead of looking at the whole picture. So I always say it's like we're treating pneumonia with cough medicine, right? We saw one thing, a person coughed, and we gave them cough medicine. It might help to clear up the cough, but it doesn't cure the pneumonia. I know there's no cure for an FASD, but the analogy still works because we're not treating the full child. We're treating one aspect. Again, going back to this, if we give a person with an FASD medication for ADHD, we could be treating some of the effects, but we're not treating all of them. And if you've never been to a doctor who gave you a bad diagnosis, yay for you, but it happens so often. And so we get the prescription to address the problem, and then we spend a month taking the prescription with no outcome, no change. And then we get another prescription, and we spend another month. And we waited 2 weeks to get back to the doctor anyway. So now we're 2.5 months into this. And think about the frustration, and think about all the other things that are going into having a child with an FASD, and the frustration and the level of concern and chaos that's going into this. We have to have more information in the general population so that these disorders are being properly identified and treated. Again, All right, so the concerns across the lifespan for first with infants, there's sensory and regulatory problems, irritability, poor sleep and wake cycles, failure to thrive, nursing difficulties. Again, especially if that palate is affected, that's why they're going to have those that failure to thrive and nursing difficulties, and then poor immune function. Toddlers and preschoolers continues those delays seen as an infant. They're fidgety, distractible. They have fine and gross motor delays. They have a loss of previously learned material. They don't remember what they knew yesterday. They fail to comply. So it looks like that oppositional defiant disorder. They have sensory issues. I know a boy who only wore corduroy pants even in the dead of summer because he needed to rub his pants to calm himself. They have other concerns that lead to suggestions of, oh, your child might have an attention deficit disorder, your child might be a oppositional defiant, your child might have reactive attachment disorder. And again, kind of grasping at straws, that low-hanging fruit, instead of looking at the big picture. The failure to comply has to do with the inability to follow a lot of directions oftentimes. So they get a diagnosis of oppositional defiant when really I just forgot what you told me. I forgot to do what you told me. You told me 5 things. You told me 3 things, and I did one of them, and then I got distracted. So very typical of these children. And then they grow up a little bit and they are continuing to have hyperactivity and attention problems, visual spatial ability problems, math problems, performance IQ versus verbal IQ. Oftentimes the verbal IQ is fine, but they might not know what they're saying. And they have problems with their social skills. So imagine being a budding adolescent and not being able to accurately comprehend social rules and expectations. How long do you think it would take to begin losing friends if you didn't understand ideas like the subtleties of body language? So when your friends say something and then roll their eyes at you and you didn't understand it, or understanding the semantics of preteen language, like the difference between knowing when something is cool or hot and not realizing it has nothing to do with temperature because they think in a very abstract, very concrete way. The frontal lobe of the brain is the area that can be affected by prenatal alcohol exposure, and it's the one that's responsible for executive functioning and abstract reasoning. Understanding nonverbal language, like body language, requires this executive functioning that may not be present. Then they become adolescents and teens, and they continue with their executive function deficits, including faulty logic, impulsivity, and poor judgment. And then they get diagnoses for mood disorders, ADHD. In person trainings, I always ask the person in front of me to, so I say, can I have your phone? Because we all have our phones out, right? Can I have your phone? And they hand me their phone. Well, a person with an FASD just received a gift of a phone, right? I didn't say, can I borrow your phone? I said, can I have your phone? And that impulsivity, that poor judgment gets them into a lot of trouble. The lack of stranger danger gets them into a lot of trouble. The poor judgment and thinking, you just gave me your phone, you can't have it back. Now it's mine. It's a really hard concept to understand if I already have faulty logic, poor executive function, and poor judgment. So tons and tons of stories I could tell you about young adults making those bad decisions and getting themselves into trouble. And so, again, our systems of incarceration, our jails and prisons are filled with people who have FASDs but no diagnosis. And then we grow into adults, and those cognitive, behavioral, and functional deficits continue. Again, there's oftentimes a lack of abstract reasoning, so they don't understand time, they can't manage money, and so they can't live independently oftentimes. And they would benefit from case management, vocational support, housing support, and so on. Training video talks about a mom who is taking care of her adult daughter, and every single month she separates the money, and every single month she says this is the month she's going to understand it. Here's your rent money in envelopes, here's your rent money, and here's your recreation money, and here's your food money. And every month she goes back and it's the same conversation because she didn't understand that abstract thought. There are tools that can be used, like a watch that both alarms and buzzes, to help people to adapt to life. But we have to know what's wrong first before those tools are going to be effective. When we talk to kids, we often say things like, we're gonna leave in two SpongeBobs. So kids understand that's two 30-minute shows. We don't do that with adults. We don't think that we're gonna have to, but that's the same thing. If I don't understand time, I can't show up on time for things. I can't understand when I'm supposed to get ready and when I'm supposed to leave my house. Diagnosis for fetal alcohol syndrome. So remember, there's fetal alcohol syndrome. That's about 10% of the population of all of those who have a fetal alcohol spectrum disorder. The diagnosis for fetal alcohol syndrome is that pre or postnatal growth retardation that brings them in for height and or weight at or below the 10th percentile. Those specific facial anomalies, the small palpable fissures, the small eye openings, the thin lip, and then the upper lip, and then the smooth philtrum, that vertical, I always forget if it's horizontal or vertical, that vertical ridge between your nose and your mouth, that's smooth. And then those central nervous system impairments, and they have to be corrected for racial norms if at all possible when we are making these diagnoses. So somebody developed these great pictures with a ruler so we can measure the space between eyes, and we can also look at the different races of what a thin upper lip and that smooth philtrum will look like. Of course, it helps if we have the parents there to show us what their lips look like, but oftentimes these are children who end up in foster care or in adoptive care. So from the bottom up, left is white, right is black. The bottom up is not thin upper lip and the full philtrum. Going all the way up to number 5, that shows no philtrum and that thin upper lip on both races. Note that these children are not smiling, because that makes a difference too. Our lip becomes much thinner when we smile, and we have to take this into consideration. These can be requested. You can get your free guide from this website, and you can get these slides at the end. Please note that documentation of prenatal alcohol exposure is not a requirement in the United States of having fetal alcohol syndrome. So when these children end up in foster care or in adoptive care, no one has to be able to say, yes, indeed, in fact, mom did drink during pregnancy. It's not part of that. So the others that we talked about, the smooth philtrum, the facial anomalies, the small head circumference, the small size, the eyes that are smaller, those are the things that need to be identified. But it's not, those things don't only talk about fetal alcohol syndrome. Talk about that in a later slide. So these are the discriminating features in fetal alcohol syndrome in a young child. Again, 10% of the population that has fetal alcohol spectrum disorders. They have the small eye openings, that flat elongated philtrum underneath their nose, a short nose, flattened mid-face, a thin upper lip. Oftentimes we think that their eyes are wider apart, and in fact it has to do with their eyes just being smaller. The central nervous system impairments. Again, we talked about poor fine and gross motor coordination. There is typically mental retardation, but not always mental retardation that goes along with this. learning disabilities, developmental delays, speech and language deficits, language less. So I can think I know the right word, I can use the word correctly, but not necessarily know what I'm saying. Language is very abstract. It's not concrete, so it doesn't mean I'm using my language properly. The speech deficits occur, memory and processing problems, and attention problems and hyperactivity. Cognition, there are specific learning disabilities, poor academic achievement, discrepancy again between those verbal and nonverbal skills, not understanding body language, yeah, right. A a person with an F, yes, okay, let's do that. Slowed movements or reaction to people and stimuli. The slowed movements have to do with that motor skill problems, and the reaction to people and stimuli. Often there's no stranger danger. They don't have an understanding of stranger danger. They also don't have an understanding of relationships. So if I just meet somebody, my reaction might be to hug that person. Um, I just meet somebody and I might be think that that person is now my best friend. That impact on executive functioning, poor organizational and planning skills, poor or lack of impulse control, concrete thinking, lack of inhibition, poor judgment. These are people who will oftentimes be taken advantage of because of their lack of inhibition and their poor judgment. They can end up being victims of sexual assault, bullied, um, willing participants in stealing. I knew a story of a kid who dropped his pants in front of a bus because he wanted to belong to the kids who told him to drop his pants in front of a bus, even knowing he shouldn't do that. He just wanted to be friends with them. And being friends is really hard. And then there's also sleep and appetite disturbances, oftentimes, the motor functioning, delayed motor skills, balance problems, poor dexterity. These are not athletes. And think about growing up and how important athleticism is, even if it's not team sports, right? Even if it's just playing outside, running, jumping, catching. They're not oftentimes the most athletic individuals. Difficulty completing tasks, a sense of being overwhelmed, trouble with transitions, distractibility, and overactivity. Children in grade school often do fairly well while they are in one classroom. When they have to move to middle school and they have to change classes, that's when that transition problem comes in. They become very overwhelmed, and that's the word that so many, I just got overwhelmed. They don't do well all of a sudden because they don't have the ability to manage those transitions. They need help. Oftentimes, they'll just end up in the toilet for the rest of the day, in the bathroom for the rest of the day, because it just got to be too much for them. And again, these are people with FASDs, young people with FASDs will say, one of the most prevalent things that they say is, I was overwhelmed. The impact on social skills, again, they have that lack of stranger danger. They tend to be immature. Superficial interactions, like I said, oh my gosh, now you're my best friend. We just met earlier today. They are then taken advantage of. They don't choose their friends wisely. And again, that poor perception of social cues. They don't know when they're being taken advantage of. They don't know when they're being teased. They don't know when they're being set up. And here's a really important aspect of this. Again, there is no feature of fetal alcohol syndrome, that 10% of the fetal alcohol spectrum disorder tree umbrella, or any of the fetal alcohol spectrum disorders that is unique to prenatal alcohol exposure. There's not something that says, yes, this is the diagnosis. So there are a lot of other things that could cause growth retardation or that central nervous system impairment. There are other factors, environmental factors like poor nutrition, abuse, neglect, depression of both baby and mom. or child and mom that can lead to that, as well as lead exposure for children. So other syndromes that include that constellation of the facial features, similar to fetal alcohol syndrome, include Williams syndrome, Noonan syndrome, Dubowitz syndrome, fetal dilantin syndrome, and now even fetal fentanyl syndrome. If we're not completely aware of what we're looking at, we're going to make mistakes. And I just want to be really clear again. Think of the umbrella of fetal alcohol spectrum disorders. 10% of that is fetal alcohol syndrome. The rest of those, the other 90%, don't even have these facial features. But we're still misdiagnosing all of them because it could be all of these other things, or it could be fetal alcohol spectrum disorders. So we need to intervene. We need diagnostic services as part of this continuum of care, but there are 9 diagnostic centers in all of the United States, which is leading to, actually, it's a chicken and egg argument. Which came first, the lack of diagnostic centers or the lack of people looking for a diagnosis? Because that actually came up in a conversation. Or is it, which is it? I don't know that answer. I know that we are completely underdiagnosing people with FASDs, but I don't know why. I don't know if we've done, if it's, would we have a diagnostic center in every state or 2 in every state if more people knew about it? I don't know that answer. So we need the medical team, we need mental health team members, case management, education members, therapy, other health and allied health services, and then family support and respite, because this is really hard working with people who have, or living with people who have fetal alcohol spectrum disorders is really hard, especially when they're not properly diagnosed. Those intervention strategies include structure and consistency, safe living environments, including adequate food and sleep, concise and explicit directions, repetition of those lessons and steps, stable routines, visual aids, support, and controlled amount of stimulation, which I contend we don't have in our social media world today. Those concise and explicit directions, we would all do better with concise and explicit instructions, right? And so I did a presentation like this at our shelter that served people who are homeless, and all of the staff were like, "Oh, that sounds like George." Because George would be given 3 instructions. You need to go to your room, you need to clean it up, you need to get ready for bed, you need to put your pajamas on, and then you need to brush your teeth and go to sleep. And George heard, "You need to go to your room." He might have heard, "You need to clean it up." Uh, and then he got distracted. So he would go to his room, find something to read or play with, and then that would be the end of it. So an hour later, he's supposed to be sleeping, and he's still sitting in his room. And oftentimes, again, we think of that as willful disobedience, but it's not. It's the inability to follow directions because the directions were not concise. And so all of us would do better with all of these things instead of life being harder. In summary, there is no cure for fetal alcohol spectrum disorders or any fetal drug syndrome. An early diagnosis makes for a better outcome. Early supplements of choline may help. NIAAA-funded scientists report that early life dietary choline supplements improve some of the cognitive and behavioral symptoms associated with FASDs 4 years after treatment ended, suggesting that choline treatment during an important time window from 2.5 to 5 years old can alter brain development in a way that produces lasting therapeutic behavioral effects for children with FASDs. So again, let's talk about when we're getting those diagnoses. They're not happening at birth. Those facial features are oftentimes not recognized at birth. Certainly the FASDs umbrella are not being recognized at birth. So when is that coming? The study on even fetal fentanyl syndrome, that's not happening. The diagnosis isn't happening until these unless it's that full blown. You can see that it's happening at 3 years old. And so we're missing that really important intervention period because we're not identifying drugs on board at birth. Now, drugs on board at birth doesn't mean we're going to get a diagnosis of anything, but it gives us a head start. It gives us a much better opportunity to recognize that, oh, baby might have something going on, and we can intervene and treat it instead of waiting for it to get worse and not even recognize it. And so that's why I'm a huge proponent for the universal umbilical cord testing for all drugs of abuse, including alcohol, which remains a drug. Um, they may need support for their entire lives. They are at increased risk for victimization and health risk behaviors. I want to point out on these additional resources that FASD United is the National Alliance for Fetal Alcohol Spectrum Disorders, and they pull together all of the different state programs. So it is an absolutely wonderful tool, website, and resource for you. And that's it.
Subscribe to our channel to see more videos like this.